Hispanic ladies, I've actually had more trouble in getting them to the vaccine than in them accepting the vaccine. And that is because of fear of deportation, fear of just our government-based systems, and I understand that. So I have actually escorted one of my patients to, well, actually multiple of my patients now, to vaccination centers because I wanted them to feel safe and feel good. And that has worked well, but it's not a sustainable method, and I realize that. I've also had some pretty frank discussions with some of my Hispanic patients around Catholicism and vaccination, and we've talked about, there was a misinformation going around for a while that the Pope banned the Johnson & Johnson vaccine, and that is not true, as you know. And so we talked a little bit about that, and we talked through any concerns related to religion, related to fear of retribution. There's a lot of government conspiracy theories that my patients worry about, and especially I see this in my Latina population, and I understand that, right? In our historically marginalized minorities, especially in this area, they've had some pretty tough challenges as it relates to reproductive medicine, and I think that further complicates their willingness to get the vaccine. However, when they're willing to talk to me about it and when they're willing to ask me the questions, we can usually work through those things. And then I find that the next issue is more about things like transportation, getting time off of work for those that work, and knowing where to go, what to do. Originally a lot of our vaccine administration places were requiring an email and a phone number and things like that, some of which my patients don't have a mobile phone number or don't have access to email. So those were pieces that we really had to work through. And then once we were able to get through some of those, now, fortunately, a lot of our health departments are making it much easier for patients to simply walk in and get a vaccine. So as we work through some of those initial challenges, we've been able to help people much better.